Hi, I'm Janet Hieshetter, past chair of the American Brain Coalition and executive director of the Dystonia Medical Research Foundation, or the DMRF. Dystonia is a neurological movement disorder that affects adults as well as children. And the DMRF is an organization that has been working now for 45 years to support research that will ultimately lead to a cure while providing programs of education and support and advocacy to our patient community. And it's advocacy that I want to talk about today. I've really had the privilege of working with patient organizations now for over 25 years, and I am constantly blown away by patients and their families' willingness to share their personal stories to help advance the understanding of that particular health issue that will lead to more research funding. I've experienced the power of a personal story and how they can really move legislators and their staffs to helping us to make sure that there is funding for good science. I recognize, and I think many do, that it's a big deal to share the intimate details of your particular brain health issue. And I think that makes your story that much more powerful. You don't have to worry about being an expert in legislation or public policy. You don't have to worry necessarily about the bill numbers or the statistics. All of that can be contained in the materials that you're either going to send or leave with the legislators and their staff people. What you need to do is just be an expert in your story. And the good news is you already are. I've seen firsthand how legislators are really moved by these personal stories. We had an advocate, a young woman who was meeting with a senator, and she happened to be about the same age as his daughter. And her story about how dystonia had changed her life touched him very deeply. And he has a standing order in his office when she is on the Hill advocating. He wants to see her, even if it's just to say a quick hello. And I've seen him do it. I've seen them pull him out of committee meetings just to greet her in the hallway. And that's the power of personal stories and what you bring to this. Your stories are etched in their minds. Again, you don't have to worry about the scientific jargon when you're trying to describe your particular health issue. You just want to describe it as you would to a neighbor. You're not a scientist. You don't have to worry about being an expert in science in that particular health issue. You just have to be the expert of your story. Advocating is a way for you to battle back against your neurological disorder. While the researchers do what we need them to do in their laboratories, we can help them get funding for that, for really good science. And it's your personal story that's going to make a difference. It can be the call to action for that particular member of Congress to help them understand why funding neurological brain research is important. And you can do that. You can make the difference. And thank you for doing that.